One moment, please. Hello, everyone, and welcome to our virtual health symposium entitled How Lupus Affects the Asian American Community. My name is Kelly, and I am the creator and executive director of the Portland-based nonprofit More Than Lupus. And on behalf of myself and everyone involved with More Than Lupus, we are thrilled to be presenting this forum in partnership with our West Coast patient advocates and partners, including California-based lupus nonprofit Looms for Lupus and GSK, as we come together to bring critical awareness to the often overlooked lupus in minorities health crisis. A staggering 2/3 of Americans know little or nothing about lupus, a disease that disproportionately affects women, and in particular, women of color. Additionally, Asian populations are reported to have higher rates of active disease compared with the Caucasian population. Now, why is this? No one knows. It's not known why lupus is more common and often more severe in Asian Americans compared to the general population. And this appears to be true for almost all Asian American ethnic groups, no matter their heritage. And this needs to change. And it starts with us having all an open and informative conversation about these statistics and how, as a community, we can be a part of this change. That being said, let me introduce our moderator and community leader, Deena Fackett. Now, Dina has lived with lupus for 26 years and is a stage 4 lupus nephritis thriver and has a passion for helping families, physicians, elected officials, pharma, and others improve treatments, outcomes, and quality of life for lupus patients. Dina is exceedingly passionate about diversity and equity in all aspects of her life and is a staunch advocate for addressing and eliminating health disparities, equitable healthcare, access issues, especially as it relates to minority health. Dina lives in the suburbs of Chicago with her husband of 16 years and 2-year-old darling daughter. And she has worked in the nonprofit sector for over 20 years for Make-A-Wish. And when she's not advocating or running after her little one, she enjoys reading, traveling, and cooking. Thank you, Dina.
Thank you, Kelly. Good afternoon, everyone. So very thrilled that you were able to join us, and exceedingly grateful to More Than Lupus, to Looms for Lupus, and to GSK for your commitment to minority health and for bringing this critical conversation to the forefront. As Kelly mentioned, my passion for diversity and equity in all areas of life is high, but certainly as a patient, as an Indian patient with lupus, that is, it's colored and shaped and formed an experience for me that might be very different than for someone that isn't Indian or Asian background. And we're so very excited to have a few different presenters today to talk about those very experiences that impact the Asian community with lupus. So without further ado, I'd like to go ahead and introduce our very first speaker, who is Dr. Lauren Kim. Dr. Lauren Kim moved to the Pacific Northwest from the East Coast in 2004, where she did a residency at Yale University School of Medicine and fellowship at the Boston University School of Medicine. She's currently practicing at Northwest Rheumatology in Portland, Oregon. In her words, "I believe a relationship between a patient and her physician is that of a partnership. I give the patients the information that they need so they can make the best informed decision possible. One of the reasons I went into rheumatology is because I enjoy building long-lasting relationships with patients. I still find this one of the most fulfilling parts of practicing medicine." Please welcome Dr. Kim.
Hello. It's nice to be here. Thank you so much for inviting me. Certainly this issue is relevant to me as well, since I'm Asian American. I actually moved to the United States with my parents from South Korea when I was 9 years old and landed in New York City. And none of us spoke any English, but we went to, myself and my siblings went to public school, and they obviously did an okay job because here I am, a physician. So hopefully some of the information I have today to share with you can help people understand a little bit. I think having researched this issue, one of the most important thing that I came away with is that there's still so much that needs to be explored. There hasn't been enough studied to date. So with that, I'll go ahead and start my presentation. Let's see. So here we are. So since I'm not entirely sure whether everybody here is an expert, I'm just going to say a few words about lupus in general. So an autoimmune disease is one where your body is not recognizing self. So when we're in utero, in our mom's bellies, our body is taught to recognize self versus non-self. That's one of the most important things that happen when baby's in the womb. Unfortunately, some people do develop autoimmune disease, and again, that's when your body becomes confused and starts to recognize, thinks that self is foreign and starts to attack itself. When we talk about rheumatoid arthritis, the immune system is attacking joints. When we talk about something like Hashimoto's thyroiditis, it's attacking the thyroid. When we're talking about lupus, the immune system can attack pretty much any joints or any organ. Unlike, organ-specific diseases, lupus can really attack any organ. It can affect the skin, it can affect the brain, kidney, lungs. So it is often a more serious disease because of that. Symptoms vary depending on the organ system involved. And although we talk about blood tests and making the diagnosis of lupus, it's actually quite challenging, even for rheumatologists, to sometimes come up with the diagnosis. And for some people, it can take months, sometimes years, to get the correct diagnosis, because sometimes it could be quite elusive to make a definitive diagnosis. So as Kelly mentioned, lupus is much more common in women than men. For every 8 or 9 women that has lupus, it affects 1 man. The peak age of occurrence for lupus is during reproductive age, between the age of 20 and 30, but we certainly can see it in any age. There are some patients who develop what looks like rheumatoid / lupus in childhood, and then it can evolve into a full-blown disease later in life. And then occasionally, rarely, we see it in elderly people, and occasionally in elderly males too. So it can affect people at any age, although its peak ages between 20 to 30, 35. So the main question here is there a difference in lupus between races and ethnicity? There's been many studies over the years looking at differences in both incidence and prevalence, and I'll explain that in another slide. But between Caucasians and African Americans, and I understand there was a forum prior to talk about that, but there really hasn't been many studies looking specifically at Asians or Hispanics in the United States. So I had to do some digging actually to find data. So Center for Disease Control, which many of us have been hearing a lot about because of the COVID, they're a very important group for sponsoring research. And they sponsored 4 studies between 1990 and 2010, looking at differences in lupus among racial and ethnic groups. So there are 4 main studies that were done: Manhattan Lupus Surveillance Program, or MLSP, California Lupus Surveillance Project, CLSP, and Georgia Lupus Registry and Michigan Lupus Epidemiology and Surveillance Programs. The data from MLSP and CLSP showed higher rates of lupus in Asian Americans compared to whites, and I'll show you that data. But before I do that, I just wanted to explain in just 2 words the difference between prevalence and incidence, because this can be an important definition that you may come across if you ever read these kind of studies. So prevalence is when you refer to a portion of patients who have the existing condition at that time period. So anyone who has that condition. Whereas incidence is a proportion of patients who develop or had new onset of that disease during that particular time period. So you'll see those words thrown around quite a lot when you look at data on disease occurrence. So MLSP prevalence, so how many people have it in that population. So in the Manhattan Project, it showed that African-American women, there was 210 or 211 out of 100,000, whereas Caucasians were about 64 in 100,000. Whereas in the Hispanic population, there were 138, and non-Hispanic Asians were 91. So both Hispanic and non-Asian, and Asian groups, it was definitely higher than the white population. In the California study, it showed, again, very high numbers in Blacks, Hispanics, and Asians compared to whites. So as you can imagine, Manhattan and California have much higher rates of diversity, with more Blacks and more Hispanics and African Americans than in Georgia or in Michigan. So the Michigan study and the Georgia study showed lower rates of lupus in Hispanics and Asians, but those numbers are so small, it's really hard to interpret that. Michigan study had a total of 25 Asian people and 39 Hispanics compared to over 1,000 African Americans and also a smaller number of whites. So those numbers were not very reliable for looking at Hispanic and Asian populations, but in the cities that had higher numbers of Asians and Hispanics, it did show that they had higher numbers compared to whites, and certainly lower numbers compared to Blacks. There was another big study looking at Medicaid data from 2000 to 2004 that showed prevalence among Asian Americans to be 175 over, in 100,000 people. And again, that group had quite a number of people in that study, 34,000 individuals. So again, that goes along with the fact that the numbers were higher in the Asian Americans compared to whites. As for the types of organs that are involved among Asian Americans, the Manhattan Project again showed that 49% Hispanics and 53% of Asians had kidney disease compared to 25% among whites. California showed increased prevalence of kidney disease among African American, Asian American, and Hispanics compared to whites. African Americans had higher numbers of neurologic disease. Both Asian Americans and African Americans and Asians had higher levels of blood-related or hematologic issues like low white blood cell count or low platelet count or anemia, issues related to blood. Asians and Hispanic patients also had higher levels of what's known as antiphospholipid antibody syndrome, which is a blood clotting disease that's related to lupus as well. The Medicaid data set also confirmed higher rates of lupus nephritis. The most serious of the kidney diseases related to lupus among all racial ethnic groups, minority groups compared to whites. Another study based on end-stage renal disease registry in the US, that's a specific data set that collects data on patients with end-stage renal disease, typically on dialysis, showed that among this population, Asian and Hispanics fortunately had lower rates of death compared to whites, even though they had more renal disease compared to whites. Blacks had higher rates of death from kidney disease as well. So African Americans unfortunately have the worst, they suffer the brunt of the complications from lupus. And again, because the number of studies in the US were pretty sparse, I also looked at a study done in Canada. And this Canadian study looked at ethnic variations also, and they showed that among over 1,000 patients, more patients of African Canadian and then Chinese Canadian patients had lupus than the Caucasian population. The age of diagnosis among their group was younger and disease duration was shorter among Asian Canadians compared to Caucasians. Neurologic disease was more common in African Americans compared to Chinese Canadians. That was similar to the California cohort. African Canadians had the highest rate of renal disease, which was actually similar among their population between Caucasian and Chinese Canadians, but the degree of kidney disease was worse in the African Canadians and Chinese Canadians. There was no mortality difference between the three ethnic groups that they looked at. So, you know, these studies are very difficult to do. It takes big numbers. It takes a lot of commitment from people who do the research. And, you know, as you can see, there are different results depending on what data sets you look at. So I just think that we need more information to help us, help guide doctors in how we treat our patients. So in summary, I would say there are very few studies of Asian Americans with lupus in the United States. Among the studies that have been done in cities with large Asian communities, including New York City and San Francisco, Asian and Hispanics have higher rates of lupus compared to whites, although not as high as African Americans. Most of the data seem to point to higher rates of kidney disease among Asian Americans compared to whites, although again, lower than rates seen in African Americans. One study specifically looking at patients with end-stage renal disease on dialysis appeared to show lower mortality rates among Asians compared to African American and whites, which would be good news, but that needs bearing out. Okay, so I'm done. If you have any questions, I'd be happy to answer them.
Great. Thank you so very much, Dr. Kim. Wow, what a lot of amazing information that you have gathered, and the data is, the proof is in the pudding that we need better information and better research in terms of the Asian population. So thank you for that. As she indicated, we're opening it up for a few minutes for some questions. We do have one from someone named Wanda. Wanda, thank you so much for chiming in. First, she has a comment. This is very relevant in terms of timing on an area that needs more awareness. So thank you. And then her question is, Dr. Kim, what can we do to close the gap between racial ethnic groups to better the quality of life for everyone? Why is it heightened in Asian Americans?
Again, there is no specific answer. I think there may be multiple different reasons why that is. Although what's interesting is one of the studies that I looked at said it's not because Asians in general, Asian Americans are lacking some of the resources that African Americans have. So, you know, the reason I think for a lot of the concern about African Americans is that they have health disparity, they don't have access to healthcare, they don't have access to good foods, they live in more polluted areas of the country. The environment, therefore, plays a role. For Asian Americans, although, you know, of course, it's not heterogeneous, but as a group, Asian Americans have decent education. They have decent quality of socioeconomic status. They have access to healthcare. So they have all those things, yet they are still affected at higher rates than Caucasians. So some of it may be genetic. So I think, again, there's a lot more to explore and study here to figure this out.
Great. Thank you, Dr. Kim. If anyone else has any questions, by all means, put those into the Facebook Live. I'd like to just ask a very brief question. So I, as an Indian patient with lupus, and again, as you said, it's not, you know, it's not intended to make an assumption across the board, but in the Indian community, stigma around illness is really one of the biggest impacts of, like, you know, how we interact with the community around us. And in general, Indians don't want to talk about or reveal that they have an illness because they might be perceived as less than or broken or damaged, you know, all of those things that go with stigma. Do you feel that potentially permeates across, you know, the larger Asian American group, and that potentially might then impact both access to care as well as participation in research or clinical trials?
I think it's certainly possible. I think in Asian populations, including Indian populations, there is certainly sort of the belief that health is, you know, important, and being sick is a weakness. So that is a difficulty, but there are so many Indian American physicians and Asian American physicians out there. So hopefully they can, you know, working within their own community, help people to understand that, you know, just like mental illness, I think even that's prevalent even among the Caucasian population, that somehow having a mental illness is a weakness. Trying to change that whole culture, that having an illness is nobody's fault. You know, it's not anything that you can do anything about other than seek healthcare to get better. And I think education is really the key for those populations as well.
Great. All right. Well, if anyone else has any questions, by all means, continue to put those in. We can always bring people back, but I think we're going to move on to our next speaker. So thank you so very much, Dr. Kim, for your presentation today.
You're welcome.
Great. Next, I'm going to introduce Melaca Cannella. Melaca is a registered nurse who founded the Sjogren's and Lupus Foundation of Hawaii after she was diagnosed with Sjogren's syndrome in February of 2011. Since that time, she has conducted research and pursued advocacy efforts to bring lupus and other autoimmune diseases out of the shadows and increase awareness among Asian communities. Please welcome Melaca Cannella.
Aloha, everyone. I hope you can hear me okay. I'm happy to be here. I was really excited when Kelly contacted me because this, I guess this whole focus has been something that I've been very interested in since being diagnosed back in 2011. And, you know, my goal was always to do research. And so this was a match made in heaven when Kelly called me. So I was very excited. I myself, I'll give you a little background. I was diagnosed with Sjogren's syndrome in 2011. There was no education by doctors here in Hawaii. did not even know what Sjogren syndrome was. And so what I decided to do was help to educate. And so I had some of the rheumatologists, we started to do some support groups with education. And maybe about 6 months into starting this, one of the rheumatologists had contacted me and said, "Hey, are you interested in having people that are living with lupus join your support group, because they don't have anyone, and I mean, they are similar, autoimmune disease, signs and symptoms, similar, where it could be confused." And so I said, sure. They wanted a home, they wanted a group, they wanted to belong. And so that's how I ended up starting to educate on Sjogren syndrome and lupus, so both. And I've been doing that since 2012. And then I wanted to do more. I wanted to get out in the community. I wanted to connect. I wanted to, do events. I wanted to do conferences. I wanted to educate, all of that. I needed to develop my foundation. And so I decided, hey, I'm going to do the foundation. I'm going to be able to get out there. And that the foundation has been a lifeline for myself, as well as many others living with Sjogren syndrome and lupus. It's been an amazing opportunity for me to meet all of you, to meet and share information. And I'm super excited about that. One of the things that I wanted to do was gather data, because I couldn't get any information on how many people in Hawaii were living with Sjogren syndrome and how many people were living with lupus. I went all the way to the state and there was no data. The only way that they could pull data was by, I guess, looking at hospital admissions, and that's not accurate. So I said, Dr. Christina Ormoto is a rheumatologist, also a good friend, and she's a board member. And I talked to her and I said, hey, let's try and, do some research of our own. Let's try and see what the population in Hawaii looks like, because we are mainly Asian. Although our culture is very diverse, it is largely Asian. There's a whole different grouping of people from around the world in our community. And so we decided to start our own research, the Sjogren syndrome and lupus data collection project. And we got approval through University of Hawaii. And we wanted to just kind of collect some baseline data, because our belief was that the Asian population was the larger community that was living with Sjogren syndrome and lupus in Hawaii. Because diabetes, if you're not familiar, is a huge population in Hawaii with the Native Hawaiians. And so when we started putting together all of the information that we wanted to gather, there was so much that we wanted to gather, but we had to start somewhere. And so we just wanted to have like a baseline just to start off, just so that we could just see if our suspicions were correct. And so she and I worked to look at what we wanted to add to our worksheet, our form. And we really wanted to focus on ethnicity. And so we worked hard and tried to break it down into different groups that we thought would be pertinent in our research. So we looked at, between 2016 and 2018, we were able to gather 74 patients' information. They signed the consent. They were agreeable to helping us to gather some information. When we discussed with other rheumatologists, people in different states, different communities, we talked to them. We discovered that nobody really was doing any type of research in the Asian population with, Sjogren's and lupus. And so we were kind of trying to see what other people were doing, see what we might need to do, but there isn't any really information out there. So we kind of just did what we thought would work just for baseline data. So we were able to get 74 patients, and the age range ran between 28 to 76. There were 73 females and 1 male, which is, right, females always the larger number that get diagnosed with lupus, autoimmune disease, Sjogren syndrome. There were many rheumatologists. So one of the questions on our research form was who diagnosed you. So we had many rheumatologists from the island as well as some in the mainland that had diagnosed the patients that we collected data on. So the different ethnicities that we looked at that were really important for us to break down and look and see who it is that's really being affected by lupus were Asian. So in the Asian grouping, we put anyone with background of Filipino, Chinese, Japanese, and Korean. So one of the things to understand about Hawaii, if you're not familiar with, is we have a very diverse culture. We have a lot of mixed ethnicities in one person. I myself have Chinese, Korean, Hawaiian, Indian, English, Irish, French. And this is not, it's not uncommon for, a lot of people to have several different ethnicities. And so Dr. Uramoto and I had a hard time to try and pinpoint this. We didn't want to break it down, but we wanted to include what we thought was Asian. And so those were the top ethnicities that we would probably see in Hawaii. And so that's how we broke it down to that ethnicity. We also looked at Native Hawaiians because that is a large grouping with diabetes here. And so we think that that has a lot to do with upbringing and diet in Hawaii when looking at that ethnicity. We also have a large Pacific Islander group. And so we wanted to break that group down into Tongan, Samoan, and Chamorro, which is the population from Guam. We have a lot of those here, as well as we have a lot of people from Polynesia, Micronesia, and Melanesia. And so that was the Pacific Islander grouping for us. We also broke it into Black, Hispanic, and Caucasian. So we ended up looking at how many, and so this is very interesting because of 74. So I'll be honest with you, we collected the data from 2016 to 2018. Dr. Uramoto and I are very busy. And so we want to continue the data collection, but we ended up stopping in 2018 because we were so busy. But what happened was when we looked at it briefly, I got sidetracked, I think. And so I didn't really look at it well until this week when Kelly contacted me, right? And we're looking at this. I said, hey, I'm going to start looking at this information. So out of 74 patients that we collected data on, 60 of them fell in the Asian population, which is a pretty large number. And the other top number was there were 8 Caucasian. So the diagnosis of Sjogren syndrome and lupus, it was kind of split even. So of the 60 Asian that were diagnosed, 21 of them were diagnosed with Sjogren syndrome, and 23 of them were diagnosed with lupus. And then we have a population where they're diagnosed with both Sjogren syndrome and lupus. And so there were 15 of them. But just looking at this information alone told me that our suspicions were correct. That lupus, Sjogren syndrome, and lupus are very prevalent in the Asian population, as Dr. Kim was discussing. So we looked at the criteria on how they were diagnosed, and we wanted to see, what might be, I guess, key factors in how they were diagnosed and what the rheumatologists were looking at. And so, interestingly, Dr. Kim had mentioned a positive ANA anti-nuclear antibody, and that was the top criteria for lupus that the Asian population have been diagnosed with. And there were 2 other top criteria was the non-erosive arthritis. So arthritis in Hawaii is, there's a pretty large population as well, and the immunologic disorders. we also, I just basic bottom line wanted to see what is the follow-up, what are rheumatologists looking at, to monitor Sjogren syndrome and lupus. And the average is every 3 months a visit to see the rheumatologist, which is great because they're doing, they're keeping close tabs on them. They're monitoring them well, which we like, which is awesome. One of the things that I wanted to discuss, what I wanted to actually talk about what Dina kind of had briefly, her question related to Dr. Kim is the illness and weakness. So in Hawaii, I'm not sure if you're familiar with our culture, and Dojo might be a little bit more familiar, is that our population is very, I don't want to say maybe humble. We're very humble. We're very to ourselves. I mean, not to ourselves. We're very open, aloha culture, right? We hug and kiss everybody. We're very open to family. We do a lot of gatherings. We want to celebrate everything. But when it comes to your health and when it comes to yourself and what's going on with your body, our culture is very, I don't know how to describe it, maybe more shy. I mean, even sometimes ashamed. And so when Dina brought that up, it kind of hit me that that's an area that, might be an issue, where the question was, what do you think might be the cause to why maybe the Asian population is not so, I guess, well represented or taking better care of themselves or whatever it be. It's because for us in Hawaii, our population, so for me, when I was diagnosed, I had a hard time telling people that I had Sjogren syndrome. I was sweating, I was shaking if I had to sit and tell someone. And when I started the foundation and I started getting contacted by all of these people living with Sjogren's and lupus, they were like, please don't share my information. I can't tell anyone. I don't want my employer to fire me. I don't want to have that stigma of I'm sick, I'm weak, I have an illness. And so very understandable what Dina was, the question that she posed to Dr. Kim, and coming from a patient myself, I totally understand that. And yes, I think that is an issue for us, not only, well, maybe in the Asian population and in Hawaii, because when I do events, when I do support groups, people come and they're very like down low, they're very quiet, they don't ask questions. And so I think it is related to culture a lot in how we get diagnosed and how we address our diagnosis with Sjogren's or lupus and how we take care of ourselves. And so one of the things that, is really important for me and what I've done to share with the foundation is to make sure that people have the support and they have the education. They don't have to say, hi, my name is Mary, I'm living with lupus, I need help. They can email me, they can contact me, we can talk on the phone, they can attend the conference, they can sit there and they can learn. They don't need to, admit that. And their employers, their family don't need to know that they have that diagnosis. So there are many, many issues with, I think, for us, trying to reach people and trying to get them the help that they need. And that's why with the foundation, my number one goal has always been education. And so I try to educate wherever I can, and however, whatever format. Virtual, my first time doing virtual education. I usually speak at conferences and our, wellness events. And so I'm willing to do what we need to help educate in this area, because the health and wellness of everyone living with lupus, Sjogren syndrome, autoimmune disease, really depends on the support that we provide and the research that we do. I attended the Lupus Conference last year in San Francisco, and I looked at all of these amazing research projects that a lot of the doctors from all over the world were collecting so much great data. I was like amazed. And when you look at the breakdown of the ethnicities, Oh, we had 200 Caucasians, we had 150 Black and Hispanics, you know, and then, well, we couldn't find any Asians, so we had two. And I was like, this is so sad. We need help. And so, that's one of the motivations for me to do my research. But as well, I want to encourage everyone, talk to your rheumatologist, do some research, connect with any of us here, see if there are any clinical trials going on, because the Asian population really needs to be represented. To have the best treatment and the best care for us, we need to be out there. We need to be able to share our information. We need to be able to be open, to letting them know what works and doesn't work. It's a large research project, as Dr. Kim was saying, and we need to do more. I'm hoping Dr. Christina Remoto and I are hoping to partner with someone, who is in a large organization who can help us to further our research. Hopefully the baseline data that we have and the information that Dr. Kim shared really does give someone, a little glimpse into how the Asian population does need to have more research to help us to live with these autoimmune diseases. Mahalo to everyone who helped put this together. More Than Lupus, Looms for Lupus, Kelly, Dojo, Dr. Kim and Dina. I appreciate this opportunity and hoping and praying that this helps to get us the research that we need to help those, moving forward.
Great. Thank you so very much, Melaca. What a comprehensive presentation, and so impressive in terms of the data collection that you've already done, this project that you shared. You've already done some of the work, as a patient, again, for 26 years early on in my diagnosis and patient journey. I tried numerous different times to be part of different research studies and clinical trials. And 7 times in a row, I was declined because I was Asian, because at this time we are not including you. You're not included in our patient population that we're focusing on. And it was frustrating because, it's like, if you don't include us, then you won't have data or research on how the illness impacts us. But if we're not included, then you won't have that, and then you don't know how to treat us. So it's a vicious cycle, and I definitely wish you well in terms of this collaborative project that it sounds like you've just put out there in the universe. So ears might be listening there. Thank you so much. So definitely, if anyone else has any questions to add, I do have one question that came in. Photosensitivity is a prevalent system with lupus. Do you think that there is a connection between the weather in Hawaii specifically and lupus disease activity, and more specifically, the intense sun exposure?
That is a great question, and that is something that we did discuss, because so at one point when I was initially diagnosed with Sjogren syndrome, and I was having some sun sensitivity, I was getting rash when I was going out in the sun. So my rheumatologist was testing me for lupus. And so I was concerned that, hey, am I developing lupus? Is the sun affecting me? And Dr. Uramoto and I also discussed that, because we did think that that was something that might be an issue. But when we look at the data, photosensitivity is down more towards the bottom of the criteria for those diagnosed here in Hawaii. And a majority of the patients that we did look at are from Hawaii, were diagnosed in Hawaii, which is interesting. So yeah, great question.
Excellent. All right, we'll give it a minute or two more for more questions. I also want to thank you for addressing the stigma component of it, because again, it is something that I've witnessed myself. As an Indian lupus patient, I've been doing advocacy and advisory type of work as a patient for nearly 26 years, from the get-go. And I personally only know 3 other Indians with lupus and rumors of 2 others. And wow, for as many people as I know that have lupus, and it's a high number, that's a pretty small population, but obviously not anywhere indicative of the larger population of Indians that possibly are diagnosed. And it is that stigma. I see it in my own community. I see it even some of my own family members, don't talk about it. Don't tell people about it. You'll be seen as damaged. You'll be seen as weak. You know, some went so far as to say that I would be unmarriable. And that's a huge thing in the Indian community, that like, how do you present yourself as someone that's a good catch, or, you know, good for a family, when you have a weakness, when you have an illness, when you're broken or damaged or something. And it was so frustrating to hear that, because, you know, I don't perceive myself or see myself as broken or damaged. Yet my community and my family felt that way and tried to get me to, you know, quiet my mouth. And, you know, fortunately, that's not who I am as a person, and all the more reason to get the word out that, you know, no one should have to live that way. And sidebar, I'm going on 16 years of marriage with an Indian man. So that did not stop us from
That's right.
our lives. But I thank you for addressing that, because, you know, sometimes I wonder, like, is it just my perception of it, or, you know, is that something that is a barrier? Because that's a barrier then to getting that data and to getting the help out to the communities that need it the most. Because then if people are being silent about it, then they're not sharing, and they're not asking the right questions, and they may not be getting the care that they deserve and need.
And that's one of the reasons why I started doing the support groups and the wellness events and the conferences, because I want people like us to be able to meet others like us, to be able to connect and to be able to relate like this, and to be able to talk and to be able to share tips, right? Because we can't walk on the street and I can't go, hi, I'm Melaca, I have Sjogren syndrome. What do you have, right? That doesn't happen. And that's one of the reasons why, the main reasons why I do the events, because I want people to get out and meet each other. And I will be honest with you, and I tell everyone who contacts me or I talk to, who is ashamed to tell people that they have this autoimmune disease, I tell them that when I finally spoke up, that my world opened up a million times over, that I have met the most amazing people. I mean, honest to God, I have never met this type of, I guess, warm, caring people ever since sharing that I'm living with Sjogren syndrome and starting my foundation. It's been the most amazing journey for me, and I can't even explain or express how it's helped me to support me living with this autoimmune disease.
Great. Well, thank you so very much, Melaca, for participating today, for all of your work, and for you know, just doing what you can to help others. So thank you for joining us.
You're welcome.
All right, so I'm going to move on and introduce our third and final speaker for today. I'm pleased to introduce Jojo Aguilar, who is the Patient Engagement Liaison for GSK, with over 20 years of experience in the biopharmaceutical and healthcare industry. Additionally, Jojo is a registered nurse and rheumatology patient himself. In his own words, as a Filipino and Asian American, I am very excited to be part of the faculty for this educational symposium. I am so grateful for More Than Lupus and Looms for Lupus for their vision in bringing more awareness about lupus to the Asian American community. Please welcome Jojo Aguilar.
Thank you very much, Dina, for that kind introduction. So let me just share my screen. All right. Okay, so some of you might have seen this presentation, but I'm gonna put some Asian flavor into this. And as Dean have said, I'm Asian American, I'm Filipino. I'm also an immigrant here to the US, which I think a lot of us Asian Americans fall into that category as second generation immigrants. And so what I'm gonna share with you, should not be a replacement of your discussion with your healthcare provider. But hopefully what I can share with you are great tips and information that would help you really manage your lupus well. I think one of the things that we've heard from both Dr. Kim and Melaca is in the Asian American culture, there seems to be that stigma, that I think that culture of shame and culture of fear, because for the most part, even me as an Asian American, we tend to be more just passive, right? We don't tend to speak up. We don't tend to share what we have, and especially dealing with a chronic autoimmune disease like lupus. So I just want to share with you three things. First one is really the importance of communication. And I want to start this off by quoting Dr. Askanase from Columbia University. She's a rheumatologist, and she said, and I quote, "I have seen these challenges reflected in my clinical practice. It is critical that patients and physicians understand the importance of clear communication because it has implications for disease management. For example, patients may not mention low-level disease symptoms as they may consider a normal part of living with lupus. However, low-level disease activity can still cause organ damage and may represent a missed opportunity for identifying a flare and instituting early intervention." So I think what I learned from Dr. Askina's quote is, really it is important for your physicians to really know a whole lot, not just about your symptoms, but really also how does lupus affect your life. I think that's very important for you as an Asian American to really communicate with your physician and your healthcare team because it may represent a missed opportunity for identifying a flare and instituting early intervention. And as we know, communication in general is very challenging, and even much more in our Asian American culture because we tend to be more, again, passive. We tend not to share about our health. We tend to keep it quiet. And for the most part, and even my own personal experience, because of the fact that family plays such an important role in our life, especially our parents. And especially I've met a lot of young Asian American dealing with lupus, and sometimes it's even hard for them to tell their parents exactly, what is going on in their life because they don't want to disappoint their parents. Because especially the second generation Asian Americans here, whom their parents have come to America, worked so hard to send them to school. One of the most common things I hear from patients, especially in the Asian American culture, is, "I don't want to disappoint my parents." And so that really represents a challenge in terms of communicating not just with family but more importantly also with your healthcare team. So that's one of the things that I would encourage you as a patient. It's one of the best ways to ensure that your physicians really understand what you're going through living with lupus. And I just want to show this chart a little bit. This was a survey done in 2011. And basically, almost 1,000 members of the lupus community were surveyed. And it showed that 52% of patients reported that they minimize their symptoms when they talk to physicians. And I think this is very, very common, especially in the Asian American culture, that you may not really tell your physician everything what you're going through. And on the other hand, almost two-thirds, three-quarters of physicians were unaware that their patients tend to underreport their symptoms. As you can see, there's already a gap between physicians and patients. So really, having an open and honest communication with your healthcare team is such an important part in managing your lupus. Talk openly with your physician, especially on topics that you may feel uncomfortable with. Topics like pregnancy, or if you're a college student dealing with lupus, how does lupus affect your way of life? How has lupus affected your relationship between you and your family, you and your spouse, you and your friends? What's really important in lupus management is really having that shared decision making where you really want to be open with the physician in terms of what is important for you as a patient. And not just, and again, as an Asian, right, most of the time when somebody tells us something, we just tend to accept it. And sometimes we may leave the doctor's office with more questions than answered than more questions that are answered, right? And so I think really having that shared decision making is so important. Discuss that with your physician. Come up with a plan that will not just work for your physician, but more importantly, that would work for you. Report all symptoms. Again, very, very important because as we know, the pattern of lupus flares waxes and wanes. You have good days and bad days. And so it's very important for you to really paint that picture with your physician of what has been going on over the period of 2 to 3 months since the last time you saw your physician, because you really want to paint that picture of the pattern of your flare symptoms and not just on the day of appointment of some of maybe the symptoms that you can remember. So that's very, very important for you to communicate with your physician. So the second thing that I think is very, very important as part of lupus management, and I think as you prepare for your appointment, especially in this whole telemedicine world right now, is to really keep track and journal your symptoms. Very, very important. Again, really, if you haven't journaled, I've heard this from a lot of lupus patients how journaling has really helped them. Really involve friends and family. Even when you are with your appointment, bring them along. They could be a set of another set of eyes and ears for you. Bring somebody with you that could really vouch for you as well of what's really been going on. And one of the important things that you need to tell your physician is how has your symptoms changed over time? How has lupus affect your daily life? How has lupus prevented you from doing things that you enjoy most? Does lupus make you feel isolated? Does lupus make you feel depressed? And so on and so forth. So these are things that are very important for you to share with your physician. So this next few slides, I just want to share with you some resources that GSK has actually developed. And we have this program called Us and Lupus, and it's a free program for patients to sign up. And Us and Lupus is more than just information about lupus, but it provides you the skills and tools necessary to help you manage your lupus lupus impact tracker, lupus journal, one by one of some of the tools and resources you over a period of time, especially knowing that lupus is a multi-organ chronic autoimmune disease. So it could affect any organ. Completed checklist to your next medical appointment. Next is
Sorry, Jojo, I think we may have lost you.
another resource that's also very, very important is is a lupus journal. So this lupus journal allows you to feelings and thoughts that you may have dealing with lupus. And we also have this appointment prep guide that could help you prepare for your virtual appointments and telemedicine. And there's also this lupus dictionary that can help. I really want to encourage you to connect with your local lupus advocacy group. We have more than lupus. We have LFA, LRA. We have Looms for Lupus, and as what also Melaca have shared in Hawaii, the Sjogren's and Lupus Foundation of Hawaii. So in summary, as a patient, you are a key component in assessing your disease activity. I would encourage you to promote and open and ask tools and resources available to you and stay active in being educated about your lupus. And before I end this, I want to share with this takes less than a minute of one of the patients.
Jojo, I think we're losing signal on you for a moment here. Not sure if you can hear me. All right. Hopefully he will be able to jump back in. And if there's any questions that anyone wants to put in either for Jojo or for Dr. Kim or Melaca at this point. And otherwise, you know, thank you so very much, Dr. Kim, Melaca, and Jojo for participating. Oh, hold, please. Jojo, are you back?
Yes. Was I cut off?
Yes, unfortunately. So whatever, if you want to pick up where you said it'll just take a minute, you wanted to share something.
Yeah, I just want to share this video. It's really a nice video of an Asian patient with lupus. So let me just do this again.
Jojo, we're not seeing or hearing anything. So I'm not sure if you have shared your screen or if there just might be a technical issue. Jojo, unfortunately, I'm sorry. I think there's a technical issue that's not letting us hear or see the video that you are sharing. So did you have anything else you wanted to add to wrap up your presentation?
No, that's it, Dina.
Okay, great. Well, thank you so very much. We are so grateful to you and GSK for the support that you offer lupus patients. As you know, Jojo shared, those resources are so critical and crucial and helpful. I know I've utilized them for myself and come across so many other patients that utilize them. So if you're listening and you're a new patient or a caregiver and you need some support, please check out the Us in Lupus site. So with that said, thank you so very much, Dr. Kim, Melaca, and Jojo for participating. You know, this is again, as all of us have indicated, such a critical and crucial conversation to have, and so much more work that needs to be done. And just so grateful to hear all of the hard work and effort that each of you are already doing in this area, and looking forward to hearing more about what you're doing and collaborating with you as well. So thank you so much. And I'm going to toss it over to Kelly to close us out today. Thank you.
Yes, once again, thank you for all of your involvement. Thank you, Dina, for moderating today. We are thrilled to have this as part of our Lupus and Minorities Health series. And we will have more information for you regarding resources to follow up with a lot of the things that were said today from Melaca and Jojo, and any research that Dr. Kim can share with us as well. So we are going to close out this virtual forum, and we thank you for your participation, and we look forward to bringing you the third installment in the Lupus and Minorities Health series coming the end of August on how lupus affects the Hispanic and Latino communities. Thank you. Have a great day.